Hi, I'm Dr. Bonnie Clipper, the Chief Clinical Officer at Wambi. Today, I'm here with Sarah Gray, founding clinician and head of clinical success at Trusted Health. Sarah, thanks for taking the time to join us today.
Thanks for having me, Bonnie.
And Sarah, you know, we've been through an awful lot of change and disruption in the last 4 months, and our world continues to change at an incredibly rapid pace. As nurses and leaders, people often look to us for guidance. What thoughts and insights can you share on how we can show up as our best selves every day, and how can we help make the world a better place?
Yeah, that's a great question. I've been thinking about this a lot lately as things stretch on a little bit longer than I think any of us would have liked them to. And I think it really goes back to the first principles in caring, which is really treat the person first and the problem second. And that really requires, I think, both a lot of mindfulness and compassion. But I think the key takeaway there is that requires that goes first and foremost for ourselves too, because we can only do that for others when we do that for ourselves. Really recognizing that allows us to meet people where they are, understand what they might be going through, how they might be handling, the situations of the world in different ways. So I've been reminding myself of that every day. And then something I've recently talked about with my team is being really solution driven rather than problem focused. There's so much negativity and weight in the world right now. There's enough people focusing on pointing out and talking about the problems and what's broken, and not enough people taking that next step towards the solution or the resolution and seeing the positivity that can come out of all of this negativity.
You know, I love your point about focusing on the solutions, because I think that's a trap that so quite often people fall into. And especially since we're in month 5 of this, where literally we're all staring at the same 4 walls and the same people every day. And essentially we're focusing on the things that oftentimes aren't going the way we want them to. So by
Yep.
focusing on the solutions instead of the problems, and maybe by focusing on what's going well, is just a different lens. It's a way for us to resolve some of this, and certainly bring some of our import as nurses to the table.
Yeah, and being a leader too, I think recognizing that can and needs to start with you, because it's really easy for people to get into that trap and kind of pile on to what might have been initiated by someone else. And so it's really steering the ship in that direction when it starts to feel that way.
It's a great point, Sarah, and thanks for reminding us of that. And where can people find you on social media?
On social media, they can find me on LinkedIn and as well as Twitter. I'm Sarah H. Gray on Twitter. And then, of course, at Trusted Health, which is www.trustedhealth.com.
Awesome. Thank you so much. We appreciate that. And I am Dr. Bonnie Clipper. And remember, at Wambi, moments move us.